Hi, I'm Dr. Mickey Barber, and I am so glad that you're here listening today. I am the CEO and owner of Better Life Carolinas. We have an office in Charleston, South Carolina, and Charlotte, North Carolina, and I want to talk to you today about Vividh. Really appreciate you taking time out of your busy day to really hear about what I think is one of the most exciting treatments for women. And it is about women, and sometimes we're not so great about taking care of ourselves. So I want you to sit down, pour yourself a cup of coffee, relax, and let's talk about what we can do to really help you to feel better. This is something that surprises me how few women really talk about this, but all of the things that we go through and some of the pleasures and special things that we experience as women can result in some changes that maybe aren't so special. One is childbirth. So childbirth alone can cause a change in our vaginal integrity. So our vagina can get more lax and looser. Even breastfeeding itself can affect the integrity of the vaginal wall. So that change in estrogen can cause some dryness during the breastfeeding period. Menopause, most of us know, can result in permanent loss of estrogen. And that can not only change the lubrication of the vagina, but can also make that vagina become more narrow, shorter, less elastic, and much more dry. All of those things can result in uncomfortable intercourse and also bladder leakage. So I'm kind of surprised how many women actually have this leakage and either don't talk about it or don't think there's anything to do about it. But that can result from childbirth, vaginal childbirth, from breastfeeding, and the changes that we go through during menopause. So what happens? So this picture here, I think, is a good illustration of what you would see on the left, which is a very healthy, well estrogenized lining of the vagina, typically in a premenopausal woman. And then the other drawing is showing how over time, because we lose that estrogen, maybe you lose it not just because of menopause, but surgical menopause, where you've had your uterus and or ovaries removed. As a result of that, the lining of the vagina then gets thinner and it starts to dry out. Well, what happens when this happens? Well, it can seriously affect sexual function. Just imagine if every time you had sex, you had pain with that, or a tearing sensation, or an itching or burning sensation. Can also result in vaginal dryness, which again makes sex less pleasurable, really for both partners. And a lot of patients, I find, just automatically use lubrication, which helps somewhat, but isn't really the long-term answer. I'm also surprised how many women experience pain with intercourse. And of course, urinary incontinence, very, very common, where women are having leaking when they're jumping, running, coughing, sneezing, or having sexual intercourse. And all of that can affect how we feel about ourselves and can make us tend to want to be less intimate with our partner. Well, what are the possible therapies that are out there? Well, there are some that are over the counter and then some surgical options. So there's lubricants, like I mentioned, vaginal moisturizers, estrogen therapy, either systemic, topical, or to the vaginal wall. There is some pelvic floor exercises or therapy that can help in some women. A pessary, something to support that structure of the bladder. And then there are surgical procedures that really are for very advanced stress incontinence and are not always effective. I'm excited because we have the Vividh radio frequency technology. What are the advantages and how do they compare? Well, so if you look at, for example, the creams that you would use in the vagina, it varies based on your insurance policy, of course, and where you're getting it from. But if you look here, you're looking at anywhere from $15 per application to up to $200 to $300 a month for these different therapies. And most of them are messy, and you have to use them right before you're ready to have intercourse. The great thing about the Vividh treatment is that it was actually designed by women, and it is only for women, and it's only for the vaginal area. It's not to be used in the face or any other area, in order to really benefit women by improving our overall health and quality of life. It is truly a state-of-the-art treatment that is designed to restore vaginal tightness and address stress urinary incontinence. And it's really unlike anything that's out there on the market. Radio frequency energy has been safely used for many, many years, probably somewhere between 50 and 75 years. Ours is the only patented dual mode version of radio frequency. The beauty of that is that it can go deeper into the tissue because those radio frequency waves are being cooled as they're applied to the tissue. So that allows it to go deeper to stimulate collagen formation without any pain, any anesthesia, or downtime. So looking at it here, if you kind of compare it to some of the other technologies out there, so other radio frequencies you see go to a more superficial layer than the Vividh, which goes deep down into the tissue to stimulate that collagen and vascular tissue, which is different than the laser, which is really only doing a superficial layer. And so what the difference is there is that Genevieve is comfortable. So I've had the treatment. I had my first treatment a year ago and just had my second treatment last week. Very comfortable. In fact, if you go onto our Facebook page, you can see that I was actually filming a video while getting the treatment. It feels a little warm when it first starts, but it is not painful. It is really taking a very small tip about the size of my little finger that is inserted into the very beginning of the vaginal opening, and that of course is under lubrication, and that tip is slowly rotated over the course of 30 to 50 minutes. And while it's doing that, the surface of the vagina is not injured. So what that means is you don't have to wear a pad, you don't have to worry about having sex for not being able to have sex for a week or two. There's no sloughing of tissue because the therapy has gone deep underneath that superficial layer. And what happens is the body really starts to form new collagen cushioning at the vaginal opening almost immediately. Typically, women start to feel results in about 30 days and have the full benefit in about 90. And after about a year, and we're finding that to be true, most women need some kind of a touch-up treatment to continue to have really great results. So this just shows you kind of a different picture, again, of that radio frequency that's being applied to the vaginal wall. And that top picture there is a representation of what the probe looks like. So who can benefit from this treatment? I really feel like most women who have had vaginal childbirth should have this treatment done, even if they're having just mild changes with urinary incontinence or vaginal laxity. So if you're one of those women, and it's shocking to me how many of us there are out there who feel like they are going to pee their pants when they cough or when they sneeze or laugh or exercising or having intercourse, or if you're like me, mine was more, I think I had changed my workouts to work around, having urinary leaking when I was jumping. But my big issue was if my bladder became really full, like if I was holding it, rushing around, then all of a sudden it would start to leak. That is 100% gone now. If you're having pain during sex due to lack of lubrication, 100% we can help. If you feel like your vagina is not as tight as it was 10, 15 years ago, we can help. And if you're not feeling the same sensation, so it's harder to reach orgasm, the Vividh treatment can help. So we get asked a lot of the same kind of questions, so I'm going to try and review some of those with you right now. First of all, we get asked a lot of times, is this a surgical procedure? Do I need to go to the hospital or outpatient center? Nope. We do the procedure right here in our office. And again, it lasts somewhere between 30 and 55 minutes and really has little to no downtime. Also, is it painful? No. It really is kind of a warm, tingly feeling, but it is definitely not painful. And what can I notice and when can I notice it? Well, for me, I notice results within the first 72 hours, but we tell patients to not expect to see any real changes for at least 4 weeks. And then around 3 months, that's probably the full result there, where you're going to see improvement in lubrication, increase in sexual sensation, a decrease in that urinary leakage or incontinence, and significant improvement in vaginal tightening. So how soon can I get back to my activities? telling you, I went right back to doing everything on the very next day. So we generally recommend that you wait 48 hours after treatment before you would insert a tampon or have intercourse, but certainly the exercise you could do within the next hour once you leave our office. So there's no worry about having to have downtime, which of course none of us have any time for downtime. So who is not a candidate? Good question. We don't recommend it for women who are pregnant or currently breastfeeding. We don't recommend Vividh if you have prolapse of the bladder or the uterus past the hymenal ring. So in other words, if you can actually kind of see that prolapse on a vaginal exam. We don't recommend it for anyone that's had a large metal implant or mesh in their pelvic area, or anyone who's had chemo or radiation within the last 6 months. However, it is a great therapy for women who have been treated for breast cancer or other kinds of cancers and are experienced because of estrogen deprivation or radiation therapy, dryness of the vagina. So it's a great treatment for that, but we generally recommend that we wait at least 6 months after that treatment. So how long does it last? Big question. The clinical studies go out for about a year to 18 months now. We find that 90% of patients are still happy with their results about that 1 year mark. So everybody's going to be a little bit different. And for me, I started to notice that I was having some of my symptoms come back at almost exactly a year. I'm very excited about Vividh. Our team, we're real excited about it for all these reasons. One, it's safe, it's safe, it's safe. Number two, it's comfortable and it's a quick and easy procedure. Number three, we know the results last. We've had data to support that. And it has lasting effects. I mean, it's one treatment that'll last you about a year. The great thing is we'll be able to say goodbye to that urinary leakage or stress incontinence. It's minimally invasive, like we've talked about, only takes a few minutes and is painless. And it's something that women of all ages, all races, all sizes can benefit from. And the great thing, unlike some of the laser treatments, which you have to have 2 or 3 treatments, it only requires usually 1 visit. And you're not going to have to wear a pad or anything afterwards, again, because it's a deeper therapy. And the great thing about this, and I was guilty of not really talking about this topic before, is now we talk about it because we have something to do about it. I think a lot of women were reluctant to talk about vaginal dryness or urinary incontinence because they didn't think there was a solution. Well, now we have a solution. My best testimony is my own, I think, but we have a lot of patients like the one that's listed here that have had great results after just 1 treatment with no pain and no downtime, very few accidents after you've had the therapy. And my husband said the first time I had the treatment and we had sex, I guess a day or 2 later, he said, wow, this feels like you felt 15 years ago. So that's a great thing. And that's the kind of testimony that we hear all the time. So how much does Vividh cost? So the national average is about $4,000 for a treatment. At Better Life Carolinas, we typically charge $3,000 for that treatment. And of course, if you have a flexible spending or